Stacy Smith is having weight loss surgery again. Her first surgery was gastric band, but that simply didn't work. So today at Forest Park Medical Center in Dallas, she had another procedure, this time gastric bypass.
I had a procedure done a few years ago that I did not tolerate well. I had a great deal of complications from it, experienced a lot of reflux and indigestion because of it, and was in a significant amount of pain.
Dr. John Alexander says Stacy isn't alone. He performs nearly 300 bariatric revisions a year at Forest Park, comprising about 75% of his business. Retooling gastric bypass surgery is the most common procedure. Removing the gastric band and performing gastric bypass is second on the list.
It seems about maybe 30 to 40, sometimes even 50% of them, it didn't work for them. They start to regain weight or they experienced tremendous amount of vomiting.
3 years ago, Maurice Neely was exactly where Stacy Smith is today, in surgery, revising gastric band to gastric bypass. At first, she lost 120 pounds but gained it all back. When she got to 300 pounds, she had revision surgery.
Words can't explain, how can I explain this? It's like the Cadillac of all weight loss surgeries.
Dr. Alexander has patients from all over the country in what is one of the only revision clinics in the country. Weight loss surgery is not without complications.
Well, believe it or not, there is no such thing. I wish there was one procedure that was 100% give the 100% response. Unfortunately, there is no procedure such as procedure to be the cure for all the problems.
Maurice calls her revision surgery life-changing. As for Stacy, she wants to lose more weight, but never her sense of humor.
So I can start stripping again.
In Dallas, Barry Carpenter, the 33 News.
It also does some skin tightening.
19-year-old Braylon Harris has wanted to do something about her stomach and outer thighs since she was 17.
Probably senior year. I was still really fit, but I've always had like that one area and the one body type. So probably since then, since high school.
Now the SMU sophomore has decided to take the plunge with a non-invasive procedure the Food and Drug Administration approved in December. It's called liposonics and uses advanced concentrations of ultrasound to destroy fat cells under the skin. She says many students her age are having cosmetic procedures.
I know a lot of people have had breast augmentations, nose jobs, especially in the area that I'm in. So I think a bigger percentage than normal.
You may bruise a little bit.
Dr. Bill Johnson is the medical director of Innovations Medical in Dallas. He says about 10% of his patients are 18 and 19 years old, many of them drawn to minimally invasive technologies.
I think there started to be more interest in that, and I think it's easier to say yes as a clinician to that. You know that there's minimal risk, and you know that it's a good place to have a good first experience with this kind of work.
Dr. Johnson says most women have achieved their normal body shape by 17 or 18. Under that age, it's not recommended. Braylon's trouble spots are marked. And the ultrasound is applied. Dr. Johnson says the only real side effect is minor bruising. Braylon says it feels like a bee sting.
It kind of feels like needles are pricking me every once in a while.
Dr. Johnson says the targeted fat cells are gone for good.
The fat cells themselves are destroyed, so the fat can't come back because the cells they were living on are gone. They have been destroyed and then dissolved by the body.
Braylon says her parents are supportive of her decision, which will cost upwards of $4,000. She says surgery simply wasn't an option.
This is a lot less frightening.
Barry Carpenter, CW33 News.
Assistance to ER4, please. Assistance to ER4.
Plaza Medical Center of Fort Worth, where doctors, nurses, and a robot roam the halls. It's the Remote Presence robotic system, and for a little more than a month now, it's been there when the specialist isn't.
When did your symptoms start for you?
Emergency Department Dr. Arun Raghavan and neurosurgeon Greg Ward showed us how it all works. EEG technician Kim Heyman played the part of a possible stroke victim. The robot? It's Dr. Ward's eyes and ears. He can connect to the robot and control it from a remote location, say his home, to help figure out the best treatment options.
Dr. Ward, are you getting good volume on that?
Dr. Ward listens to the patient's heart and lungs, then zooms in on her vitals.
Okay, go ahead and stare straight ahead for me.
And with a twist of a joystick, look straight into her eyes. When it comes to emergency brain and heart conditions, every second counts.
Time is kind of the essence then. So the faster we can get a diagnosis and decide which way to go, the faster we can do some of these therapies and treatments that provide better outcomes.
Dr. Ward can even review imaging results with a patient from anywhere.
See the white area that I'm circling? That looks like you're having a little stroke.
Dr. Raghavan says the robot helps reduce the number of second-hand and third-hand conversations between doctors and the patient.
When you look at medicine, it's a collaborative effort, and when we have all physicians that are required to take care of a patient available immediately, that's a huge benefit not only to the patient but also to the expert and to the ER physician.
And what about our patient for the day?
I can't imagine being a patient, much less a family member, wanting answers. Really helps put them at ease a lot faster than normally we would be able to.
For the robot, it's all in a day's work. Barry Carpenter, CW33 News. Carrie Murray feels like a new woman, and in two ways she is. This is Carrie last year, before she decided to have breast augmentation.
I didn't want to be large, just something to make me look like I used to before I had children.
Her biggest concern was not being satisfied with the results until a friend told her about 3D imaging. No, not weird science, real science in 3D.
She looks fabulous, by far the best boobs I've ever seen.
She went to Dr. William Adams, who helped develop a 3D imaging technique that allows patients to see the after before the surgery.
1, 2, 3.
Carrie showed us how it works. The patient has her photo taken by cameras, which are turned into 3D images. The pictures are loaded into a computer where Dr. Adams performs his consultations. This is Carrie's 3D before and after simulation.
Pre-op and simulation.
Dr. Adams says 3D images give women a chance to see what they'll look like before surgery and helps boost patient satisfaction.
I would say 75% of people that come to our practice thinking they know what they want, once they go through our consultation, which obviously the 3D imaging is part of it, change their mind.
Which is good. Breast redos can account for about half of a breast surgeon's business because the patient isn't satisfied with the size, shape, or feel.
It's definitely a great thing for patients to have, in a scientific way, an accurate rendition of what they're going to look like, and that does help avoid problems down the road.
It did for Carrie, who says seeing 3D is believing.
When I came in, I wanted to be a small C with this, and I walked away as a D with these.
The 3D imaging can also be used for nose reshaping. This is Carrie's nose, and she's considering surgery. For now, she's thrilled with her real before and after.
They're perfect. They're exactly what I wanted.
Barry Carpenter, CW33 News. Inside an office building in Richardson, the robots work around the clock. The unsung heroes in the war against crooked teeth bend wire with precision for patients all across the country.
Up to the first 2 hooks on the top.
One of them is 18-year-old Megan Thompson, who is having her braces removed more than 5 months early.
What we're trying to do is move your bottom front teeth down.
Dean Jensen is one of only a dozen or so orthodontists in Dallas-Fort Worth using SureSmile technology. Orthodontists create a 3D computer model of the patient's teeth, showing how they'll line up from every angle. What used to take 40 minutes now takes 10 seconds. Then it's up to the robot to twist and bend the wire into place.
Essentially what it does is it takes the human error out of the process. Because of that, it allows us to do, a more efficient job of what we do, in particular when it comes time to finish the treatment.
Jensen says treatments that used to take 2 years now can be finished in 12 to 18 months. In Megan's case, conventional treatment would have taken at least a year. Hers were off in 7 months, well before she's off to college.
I've had braces before, and I kind of wanted to have them off. It was really important to me that I get them off before I go to college in the fall, so I'm really excited that I was able to do that.
Jensen says the robot-generated wires don't move the teeth more quickly. The key is fewer adjustments along the way, allowing the teeth to move into place in a more direct path. So if you get your braces off early, you can thank your orthodontist and the robots in Richardson. Megan did.
It's the only option that I could find, so it's awesome.